ਸਾਡੇ ਨਾਲ ਜਿੰਨੇ ਸਪੈਸ਼ਲਿਸਟ ਡਾਕਟਰਸ ਨੇ BC ਦੇ ਉਹਨਾਂ ਦੇ ਜਿਹੜੇ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਹਨ ਰੋਬਰਟ ਕਰਦਰਜ਼ ਉਹ ਸਾਡੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰਨਗੇ ਕਿ ਵੇਟ ਲਿਸਟ ਇੰਨੀਆਂ ਹੋ ਗਈਆਂ ਨੇ ਕਿ ਡਾਕਟਰਸ ਨੂੰ ਹੁਣ ਇਹ ਬੋਦਰ ਕਰ ਰਿਹਾ ਹੈ ਕਿ ਕਿਵੇਂ ਲੋਕ ਪੇਨ ਨਾਲ ਪੀੜ ਨਾਲ ਜਿਨ੍ਹਾਂ ਦੀ ਸਰਜਰੀ ਹੋਣੀ ਆ ਆਰਥੋਪੀਡਿਕ ਨਿਊਰੋਲੋਜੀ ਉਹ ਵੱਖ-ਵੱਖ ਡਿਪਾਰਟਮੈਂਟਸ ਦੇ ਵਿੱਚ ਉਹ ਕਹਿੰਦੇ ਕਿ 10-10 ਮਹੀਨੇ ਤੱਕ ਦੀ ਇੰਤਜ਼ਾਰ ਹੈ ਜਦ ਕਿ ਉਹ ਐਕਸੀਡੈਂਟ ਜਿਹੜੇ ਉਹ ਆਪਰੇਸ਼ਨਸ ਨੇ ਉਹਨਾਂ ਦੀ ਸਰਜਰੀ ਆ ਉਹ ਹੁਣ ਹੋਣੀ ਚਾਹੀਦੀ ਆ ਜਾਂ ਉਹਨਾਂ ਦਾ ਇਲਾਜ ਹੁਣ ਹੋਣਾ ਚਾਹੀਦਾ ਹੈ ਇਸ ਦੇ ਬਾਰੇ ਕੀ ਕੀਤਾ ਜਾ ਸਕਦਾ ਉਹਨਾਂ ਨੇ ਸਿਰਫ ਇਹ ਸ਼ਿਕਾਇਤ ਨਹੀਂ ਕੀਤੀ ਸਗੋਂ ਇਸ ਦੇ ਉਹਨਾਂ ਨੇ ਤਰਕੀਬ ਵੀ ਦੱਸੀ ਆ ਕਿ ਕਿਵੇਂ ਇਹ ਠੀਕ ਹੋ ਸਕਦੀ ਹੈ ਔਰ ਉਹਨਾਂ ਨੇ ਮਿਨਿਸਟਰ ਨੂੰ ਵੀ ਇਹ ਦੱਸਿਆ ਹੈ ਲੇਕਿਨ ਇਸ ਦੇ ਉੱਤੇ ਹਾਲੇ ਤੱਕ ਕੋਈ ਐਕਸ਼ਨ ਨਹੀਂ ਲਿਆ ਗਿਆ ਇਹ ਜ਼ਰੂਰ ਕਿਹਾ ਗਿਆ ਕਿ ਅਸੀਂ ਡਾਕਟਰਾਂ ਨਾਲ ਰਲ ਕੇ ਚੱਲਾਂਗੇ ਮਿਲ ਕੇ ਕੰਮ ਕਰਾਂਗੇ ਸਰੀ ਮੋਡਲ ਹਸਪੀਟਲ ਦੇ ਡਾਕਟਰਾਂ ਨੇ ਵੀ ਜਦੋਂ ਇਸ ਤਰ੍ਹਾਂ ਦੀਆਂ ਚਿੱਠੀਆਂ ਲਿਖਣੀਆਂ ਸ਼ੁਰੂ ਕਰ ਦਿੱਤੀਆਂ ਔਰ ਬਹੁਤ ਕਿਸਮ ਦੀਆਂ ਗੱਲਾਂ ਜਿਹੜੀਆਂ ਸੀ ਉਹ ਪਬਲਿਕ ਕੀਤੀਆਂ ਉਦੋਂ ਵੀ ਜਿਹੜੇ ਉਸ ਵੇਲੇ ਦੇ ਹੈਲਥ ਮਿਨਿਸਟਰ ਸਨ ਇਹੀ ਕਹਿੰਦੇ ਸਨ ਕਿ ਅਸੀਂ ਇਹਨਾਂ ਨੂੰ ਮਿਲੇ ਹਾਂ ਅਸੀਂ ਇਹਨਾਂ ਨਾਲ ਰਲ ਕੇ ਚੱਲਾਂਗੇ ਲੇਕਿਨ ਹਾਲੇ ਤੱਕ ਕੋਈ ਇੰਤਜ਼ਾਮ ਨਹੀਂ ਹੋਇਆ ਹੁਣ ਦੇਖਦੇ ਹਾਂ ਕਿ ਡਾਕਟਰ ਕੀ ਕਹਿੰਦੇ ਨੇ ਤੇ ਉਹਨਾਂ ਦੀ ਸਕੀਮ ਕਿਹੋ ਜਿਹੀ ਹੈ ਪਬਲਿਕ ਨੂੰ ਜ਼ਰੂਰ ਪਤਾ ਹੋਣਾ ਚਾਹੀਦਾ ਕਿ ਇਹ ਡਾਕਟਰ ਨਹੀਂ ਜਿਨ੍ਹਾਂ ਦੀ ਵਜ੍ਹਾ ਕਰਕੇ ਤੁਸੀਂ ਸਫਰ ਕਰ ਰਹੇ ਹੋ ਸਗੋਂ ਇਹ ਸਿਸਟਮ ਹੈ ਇਹ ਮਿਨਿਸਟਰੀ ਹੈ ਜਿਹਦੀ ਕਰਕੇ ਤੁਸੀਂ ਸਫਰ ਕਰ ਰਹੇ ਹੋ ਗੁਰਜੀਤ ਗਿੱਲ ਐਂਡ ਐਸੋਸੀਏਟਸ ਸੂਚਨਾ ਦੇ ਰਹੇ ਨੇ ਕਿ ਪਰਸਨਲ ਜਾਂ ਬਿਜ਼ਨਸ ਟੈਕਸ ਭਰਵਾਉਣਾ ਨਵੀਂ ਕੰਪਨੀ ਖੋਲ੍ਹਣੀ ਹੈ ਪੇਰੋਲ ਬਣਾਉਣਾ ਹੈ ਗੁਰਜੀਤ ਗਿੱਲ ਐਂਡ ਐਸੋਸੀਏਟਸ ਨੂੰ ਸੰਪਰਕ ਕਰੋ ਇੰਡੀਅਨ ਵੀਜ਼ਾ ਪਾਸਪੋਰਟ OCI US ਵੀਜ਼ਾ PR ਕਾਰਡ ਜਾਂ ਸਿਟੀਜ਼ਨਸ਼ਿਪ ਲੈਣੀ ਹੈ ਪੈਨ ਕਾਰਡ ਲਾਈਫ ਸਰਟੀਫਿਕੇਟ ਤੁਸੀਂ ਬਣਵਾਉਣਾ ਹੈ ਸੁਪਰ ਵੀਜ਼ਾ ਹਸਬੈਂਡ ਵਾਈਫ ਸਪਾਂਸਰਸ਼ਿਪ ਵਰਕ ਪਰਮਿਟ LMIA ਜਾਂ ਕਿਸੇ ਹੋਰ ਇਮੀਗ੍ਰੇਸ਼ਨ ਸਰਵਿਸ ਲਈ ਗੁਰਜੀਤ ਸਿੰਘ ਕਵੱਦੀ 604 767 2845 ਯੂਨਿਟ ਨੰਬਰ 103 8140 ਸਕਾਟ ਰੋਡ ਤੇ ਤੁਸੀਂ ਜਾ ਸਕਦੇ ਹੋ ਡਾਕਟਰ ਕਰਦਰਜ਼ ਮੇਰੇ ਨਾਲ ਹਨ ਸਪੈਸ਼ਲਿਸਟ ਡਾਕਟਰਸ ਦੀ ਵੇਟ ਕਿਉਂ ਕਰਨੀ ਪੈ ਰਹੀ ਹੈ ਤਕਰੀਬਨ 1.2 ਮਿਲੀਅਨ ਲੋਕ ਜਿਹੜੇ ਨੇ ਉਹ BC ਦੇ ਵਿੱਚ ਡਾਕਟਰਸ ਦੀ ਸਪੈਸ਼ਲਿਸਟ ਦੀ ਵੇਟ ਦੇ ਵਿੱਚ ਇੰਤਜ਼ਾਰ ਕਰ ਰਹੇ ਨੇ ਤੇ ਸਫਰ ਕਰ ਰਹੇ ਹਨ ਇਹ ਵੇਟ ਲਿਸਟ ਕਿਵੇਂ ਮਾਡਰਨਾਈਜ਼ ਕੀਤੀ ਜਾ ਸਕਦੀ ਹੈ ਔਰ ਸਪੈਸ਼ਲਿਸਟ ਦੀ ਕੇਅਰ ਕਿਵੇਂ ਵਧਾਈ ਜਾ ਸਕਦੀ ਹੈ ਰੂਰਲ ਆਊਟਰੀਚ ਕੀ ਹੈ ਤੇ ਹੋਰ ਜਿਹੜੀਆਂ ਗੱਲਾਂ ਬਾਤਾਂ ਨੇ ਉਹ ਡਾਕਟਰ ਸਾਹਿਬ ਨਾਲ ਹੋਣਗੀਆਂ ਡਾਕਟਰ ਰੋਬਰਟ ਕਰਦਰਜ਼ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਆਫ ਦੀ ਕੰਸਲਟੈਂਟ ਸਪੈਸ਼ਲਿਸਟਸ ਆਫ BC ਨਿਊਰੋਲੋਜਿਸਟ ਤੇ ਹੋਰ ਜਿੰਨੇ ਵੀ ਡਾਕਟਰਸ ਨੇ ਸੋ ਉਹਨਾਂ ਨਾਲ ਗੱਲਬਾਤ ਹੋਏਗੀ Dr. Carruthers, good morning. Thank you very much for joining us.
Thanks very much for having me.
So we've been listening to you and we've been reading about the suggestions you have made, the problem that you have brought forward. So could you please elaborate the waitlist crisis?
Yes, so broadly speaking, people need to be aware that we just don't have enough physicians in British Columbia in the same way that we don't quite have enough family doctors. We don't have enough specialists. And specialists are doing their best to keep up, but the way that this will start to go badly for British Columbians, and the way that it already is that we have more and more people waiting for care. Now, this means that, maybe you might have a family member who's waiting to see a neurologist to get a diagnosis of maybe Parkinson's disease, for instance. And those types of things which are slowly moving tend to get put to the bottom of triage lists. And I have colleagues now who have wait lists that are 18 months or even up to 3 or 4 years in certain areas. And so it starts to be the case that the British Columbian healthcare system is not meeting the needs of British Columbians. And one important thing just to remember is this is all areas of medicine, right? Most diagnoses of cancer where people end up receiving treatment at the BCCA, most of the referrals come from specialist doctors. So this is just one element of the healthcare crisis that we've been living through in the last little bit.
Yeah, we've been monitoring it and you have astonished us when you said 1.2 million patients are waiting for the specialists. So which specialist doctors, which field is mostly impacted?
There's a lot of There's a lot. I mean, I think some of the highest wait list numbers come from neurosurgery, where you can wait like 16 months on average to see folks. Neurology, as I said, is quite bad. Orthopedic surgery, there's long wait lists. Urologic surgery, so, if you have like prostate issues, there's a long wait list there. And also even dermatologists, they are quite swamped. And on average, a dermatologist has about 1,000 people on their wait list.
And what are your suggestions, how we can fix it? You have actually outlined some suggestions. You have met the health minister, Ms. Osborne?
We have not met with the minister yet. We've emailed asking several times for a meeting, and we have not received a response. But we do have a solution, at least a series of solutions that we think are worth discussing. So one of them is what's called a waitlist management program, where if a doctor receives a referral, a specialist doctor receives a referral, and they think, well, maybe we could just write a quick letter of advice, and then the patient doesn't need to be seen, and the family doctor would get an immediate response, it actually creates another spot for another patient to be seen, right? So it creates efficiency. And then at the same time, as we're seeing those efficiencies, the more specialists participate in a waitlist management program that we've done most of the negotiating, it would create for the ministry a view throughout the entire province for every single specialty where the pinch points are. Mm-hmm. And then they can apply really smart, targeted investments to ensure that there's care. So one really great example is rheumatology, where back in the 20-teens, there were very long wait lists for people with autoimmune conditions to be evaluated. And they ended up, through negotiations, creating a fee code that allowed rheumatologists to work closely with nurses. And it actually maybe almost doubles the number of patients that that a rheumatologist is able to see. And in the recent survey that our group completed with specialists, you can see that rheumatology doctors actually have fairly short wait lists, mm-hmm. which means that these targeted interventions can really help British Columbians get access to care that they need. And so it's that type of solution that needs to be implemented. And then long term, we just need more people in medical school and in residency, and we need them to stay here in British Columbia.
So when you said that you wanted to meet the Minister Osborne to explain your situation and suggest that there are 5 key solutions, so what did they say? What the minister said?
We haven't received any responses to emails. And my colleagues at Doctors of BC have asked and so forth. One of the difficult things, I think, is that many people aren't aware of this, the specialist waitlist crisis. And the specialist waitlist crisis is not addressed anywhere in the new minister's mandate letter. And so that's part of why we're reaching out, is that British Columbians aren't getting timely access to specialist care. And since 2022, the problem is worse, and we need to implement solutions. And I'm optimistic that we will hear from the minister in the near future.
Mm-hmm. Because she sounded very eager to fix the problems. And what are the 5 key solutions that you're suggesting, Doctor?
Right. So we want to have the waitlist management program funded. We want to see broadened access to this team-based specialty care, which will allow us to do more with the specialist doctors that we have. Part of the specialty access crisis actually is around there may be worse waits in rural areas as opposed to urban areas, and that's one thing that needs to be worked on. And once we have a full data set about where the waits are, we might need to improve some of the specialist outreach programs that exist to get specialists into, for instance, the North Island and the Interior and Northern Health. And then I also want to see maybe some changes in, instead of just doing fee-for-service, some specialists might do better on a blended payment model that would make it easier to do complex and chronic care, which the current fee-for-service structure doesn't work very well for. And then, as I said, I think increased training spots in medical school and in residency would be great, as long as we're able to retain those folks once they graduate.
So when you say that, previous government had given you some funding in order to reduce the waiting list, now that funding has been cut off?
Well, for the rheumatologists, that funding still exists, that fee code still exists, and British Columbians are benefiting from that investment. What we're asking for with the waitlist management thing, we think is a very smart investment that will pay dividends in terms of allowing us to understand where the unmet needs are, and then we can make targeted investments to address those issues. So really, as I've said, we are waiting to meet with the minister, and we're keen to move forward with the waitlist management negotiations and hopefully finalize that. But I acknowledge it's a turbulent time in politics with the tariffs, and this is a really difficult time.
So, Doctor, do you think that BC government and Ministry of Health is doing enough to kind of reduce the waiting list?
I'm grateful to them that over 2 years they worked with the consultant specialists of BC and the doctors of BC to negotiate this waitlist management solution, and it really needs to be finalized. They had been making smart investments, and I think the waitlist management...
How about now? At this time?
I'm looking forward to meeting with the minister. I think also, it's a new minister, and we just had a very big election where I think there's general agreement that healthcare was an important factor in the election outcome. And so I think, because we know that the access to specialty care is getting worse, it is time for us to get some solutions finalized and move forward on this issue.
Doctor, in closing, what would you like to say to the patients who are waiting and suffering in pain?
First, my heart goes out to you. These are difficult times, and specialists are doing their very best with what we have. The system isn't perfect, and I want you to know that specialists of BC are advocating for not just better access, but also just a broader understanding of the problems so that the ministry can better address your needs. We encourage folks to reach out to their MLAs. And there's also a hashtag for social media that we're using. It's a hashtag BC Still Waiting to talk about the waitlist crisis.
Lastly,
thank you very much for having me on.
I just want to ask you one more little thing. Is it true that all these specialists, when they're working in the hospitals, in the system, these same doctors also work in Brian Day's clinic as a private, in the private clinic also?
I think that's a very small number of people. I think most specialists are working on a fee-for-service in an office that they're paying the rent on, the electricity, the internet and so forth. There are people who don't work on that. They have a contract with a health authority. Most specialists are small business owners.
But is that contributing towards the list of these waiting people?
That is private. Are private clinics responsible for it? I don't think so. I think the crux of the matter is that we just don't have enough doctors, broadly speaking, in the province. And so now we've hit a point of saturation where the need is outstripping the supply. And so this is part of why we need to come together with the ministry to work on solutions. I think it's going to be a tough one, and one of the principal things that we need is a better sense of where the pinch points are, and we also just need more doctors.
Dr. That's very good. Thank you very much for your time and giving us this information. Hopefully it's resolved sooner.
I share your optimism. Thank you so much for having me on.
Thank you.
Thank you, sir.
ਡਾਕਟਰ ਰੋਬਰਟ ਕਰਥਰਸ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਸਨ। ਬੇਸਿਕਲੀ ਉਹ ਕਹਿੰਦੇ ਕਿ 1.2 ਮਿਲੀਅਨ ਪੇਸ਼ੈਂਟਸ ਨੇ ਜਿਹੜੇ ਨਿਊਰੋਲੋਜੀ ਤੇ ਹੋਰ ਵੱਖ-ਵੱਖ ਮਹਿਕਮਿਆਂ ਦੇ ਜਿਹੜੇ ਡਾਕਟਰਸ ਦੀ ਉਡੀਕ ਕਰ ਰਹੇ ਨੇ, ਸਪੈਸ਼ਲਿਸਟ ਦੀ ਉਡੀਕ ਕਰ ਰਹੇ ਹਨ। उन्होंने ये भी दसिया कि हाले तक उन्होंने रिक्वेस्ट जरूर की है हैल्थ मिनिस्टर जिहड़े बने ने मिनिस्टर ऑसबोर्न पर उन्होंने मिले नहीं हैं उन्होंने मिलना चाहते हैं उन्होंने रिस्पॉन्स नहीं दिता उन्होंने कोले 5 की सॉल्यूशंस ने इस दे ते ਉਹ ਉਹਨਾਂ ਨਾਲ ਡਿਸਕਸ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹਨ ਤੇ ਉਹ ਕਹਿੰਦੇ ਕਿ ਬੇਸਿਕਲੀ ਡਾਕਟਰਸ ਦੀ ਘਾਟ ਹੈ ਹੋਰ ਡਾਕਟਰਸ ਰੱਖੇ ਜਾਣੇ ਚਾਹੀਦੇ ਨੇ ਇਹ ਉਹਨਾਂ ਨੇ ਮੁੱਖ ਕਾਰਨ ਦੱਸਿਆ ਔਰ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਇਹ ਵੀ ਪੁੱਛਿਆ ਸੀ ਕਿ ਇਹਦਾ ਜਿਹੜੀ ਲੰਬੀ ਲਿਸਟ ਇੰਤਜ਼ਾਰ ਕਰਨ ਵਾਲਿਆਂ ਦੀ ਇਹਦਾ ਕਾਰਨ ਇਹ ਤੇ ਨਹੀਂ ਕਿ ਇਹੀ ਸਪੈਸ਼ਲਿਸਟ ਜਿਹੜੇ ਨੇ ਆਪਣਾ ਟਾਈਮ ਪ੍ਰਾਈਵੇਟ ਕਲੀਨਿਕਸ ਦੇ ਵਿੱਚ ਸਪੈਂਡ ਕਰਦੇ ਹਨ ਜਿਹੜੀ ਬ੍ਰਾਇਨ ਡੇ ਦੀ ਕਲੀਨਿਕ ਹੈ ਉਹ ਕਹਿੰਦੇ ਹੋ ਸਕਦਾ ਕਿ ਕੁਝ ਕਰਦੇ ਹੋਣ ਪਰ ਮੈਜੋਰਿਟੀ ਨਹੀਂ ਸੋ ਕਹਿੰਦੇ ਕਿ ਅਸੀਂ ਉਮੀਦ ਰੱਖਦੇ ਹਾਂ ਕਿ ਉਹਨਾਂ ਕੋਲ ਇੱਕ ਫੰਡਿੰਗ ਸੀ ਪਹਿਲੀ ਗਵਰਨਮੈਂਟ ਦੀ ਜਿਹੜੀ ਵੇਟ ਟਾਈਮਸ ਨੂੰ ਰਿਡਿਊਸ ਕਰਨ ਵਾਲੀ ਉਹ ਹੁਣ ਜਿਹੜੀ ਅਵੇਲੇਬਲ ਨਹੀਂ ਹੈ ਇਸ ਦੇ ਬਾਰੇ ਉਹਨਾਂ ਨੇ ਤਾਂ ਕੁਝ ਨਹੀਂ ਕਿਹਾ ਨੁਕਤਾਚੀਨੀ ਤਾਂ ਨਹੀਂ ਕੀਤੀ ਲੇਕਿਨ ਉਹਨੇ ਪਹਿਲੀ ਗਵਰਨਮੈਂਟ ਦਾ ਧੰਨਵਾਦ ਕੀਤਾ ਕਿ ਮੈਂ ਗ੍ਰੇਟਫੁਲ ਹਾਂ ਕਿ ਉਦੋਂ ਉਹਨਾਂ ਨੇ ਉਹ ਵੇਟ ਟਾਈਮਸ ਨੂੰ ਰਿਡਿਊਸ ਕਰਨ ਲਈ ਫੰਡਿੰਗ ਦਿੱਤੀ ਸੀ ਸੋ ਹੁਣ ਉਹ ਇੰਤਜ਼ਾਰ ਕਰ ਰਹੇ ਨੇ ਕਿ ਹੈਲਥ ਮਿਨਿਸਟਰ ਉਹਨਾਂ ਨੂੰ ਮਿਲਣ ਤੇ ਉਹ ਉਹਨਾਂ ਨੂੰ ਦੱਸਣ ਕਿ ਕਿਵੇਂ 5 ਕੀ ਸੋਲੂਸ਼ਨਸ ਕੰਮ ਕਰ ਸਕਦੇ ਨੇ ਤੇ ਉਸ ਨੂੰ ਲਾਗੂ ਕੀਤਾ ਜਾਏ ਉਹ ਆਸ਼ਾਵਾਦੀ ਹਨ